closeness of everybody. And so on the one hand, it was a little crazy, but on the other hand, it was part of the whole gestalt.
Right.
You know.
We are rolling anytime.
Okay, let's do it.
All right.
Well, Peter Budetti, it's great to see
Hello,
you.
Lauren Leroy. Good to see you.
Thrilled that the Institute is bringing us all together, once again. But let's start at the beginning.
Sure.
Tell me a little bit about what brought you to the Institute, how that happened.
Jack Coons. I was very interested in going into a career in doing something in healthcare that wasn't just taking care of patients. But
first, tell us
there
what
was
your
no
background was.
Well, I had already finished my training in pediatrics,
Okay.
and had been in the Indian Health Service and done internship and residency at San Francisco General and UCSF. And I wanted to do something that would help the situation surrounding medical care, not just the individual patients.
Mm-hmm.
There wasn't really a career path yet known as health policy in those days. So I thought, well, I'll go to law school, and maybe that'll help.
Put off the decision for a while.
I'll figure it out. Something will happen. Something will come up. So I went to Berkeley, which was the fortuitous development, and I befriended a professor of mine who ran something which was then called the Childhood and Government Project at UC Berkeley in the law school. And he had this brilliant idea that he would get this Dr. Lee, whom I had not known or heard of, to pay for me to work with Jack at the Childhood and Government Project. Of course, in retrospect, that was never the way anything was likely to happen. In fact, what happened was utterly predictable, which was that Jack arranged lunch for him and me and Phil and Lou Butler. And by the end of lunch, Phil had hired me to work at the Institute. And Jack was left, without me as a researcher or research assistant or whatever he wanted me to do. So it was completely dependent upon the accident of my having gone to Berkeley for law school and having had a professor who had this great idea that led to my longstanding involvement with the Institute for Health Policy Studies.
I never knew that. That's great.
Give me 1 second. You can ask the question. Just give me 1 second.
Moving on to our spontaneous conversation.
Right.
Yes, I'm sorry. Go ahead.
Okay. Well, I know that you're a pediatrician. You just mentioned that, and that I assume has something to do with some of the areas of work that you've pursued in your career. But sort of what motivated you to pursue the areas of research that you were working in? And initially, was it whatever Lou was working on, or did you actually, were you able early on to move into child health related issues? Tell me a little bit about that.
Well, I started with a job, and we were working on a study of health systems agencies and professional standards review organizations. And that went along reasonably well. And then, of course, the opportunity came along to see what else I could work on when that was done. Mm-hmm. And it was a matter of combining what was available at hand, something that could, pay the freight, so to speak, mm-hmm. and then moving into child health. And as I got more involved with the American Academy of Pediatrics, the American Academy of Pediatrics actually offered me the opportunity to serve on a national committee very early in my career. Mm-hmm. And so I was chairman of the Committee on Pediatric Manpower for the Academy. And that led me to have a lot of interest in something that was a high priority topic at that time, which was the future of graduate medical education mm-hmm. in the United States. So I got involved both in pediatrics and in healthcare personnel projections and strategies, and both of those built on themselves over time.
Mm-hmm. And also, Peter, you and I have a particular connection because
yes, we
switched coasts and
right.
You moved to Washington. So talk a little bit about that, sort of wanting to come to the Washington office and that experience and how that helped shape your future work.
It was the linchpin of my subsequent life in Washington, without any doubt. I followed in your footsteps, which were very big footsteps, dainty but big footsteps to follow in. You had built a very strong reputation for the Washington office of the Institute for Health Policy Studies in terms of being a resource for people in government on the Hill to look to for information, for policy analysis on major healthcare issues. And so when I had the opportunity to run the Washington office for 3 years after you were there, you had already built up a lot of the connections, and it was a terrific place for me at the time, because what I learned was how important it was to have that trust of the people in government. The fact that we weren't there to sell something, we weren't there to push a particular agenda of any kind. We were there to do honest policy analysis from a respected university base. And so that was a terrific introduction for me to Washington. I got to meet a lot of people. I think I built a number of connections that then later on, when various opportunities arose, people knew that I existed, and so I had the chance to take a job actually working in government, and moved back to Washington. Mm-hmm. Stayed here for many years.
And reflect a little bit on the sort of important role, the way I saw the role of the Washington office, at least in part. We were doing our own research and analysis, but the Institute had people who were what I'll call, for want of a better term, traditional health services researchers. They were doing work that they approached as a research project, but their work was clearly policy relevant, but it needed the translators to take the relevance out of that work and carry it to the policy community, both to inform them and let them know it existed, but also so that that the work that was being done could inform the policy process. And the Washington office really played a critical role in that regard. And so give me your reaction to that role and to the importance in an institute like this to have those translators who can understand both worlds.
I think it's everything. The health policy world faces exactly that issue, as is true in many other areas. But researchers who are extremely well trained in research methods are very good at answering specific questions the best way they can answer them. But those questions aren't necessarily going to give answers that will be timely for policymakers, that will be understood in terms that policymakers can find useful, or that will be available easily to the policymakers. And so the fact that the health policy world has now developed a cadre of people whose job it is to be sophisticated enough on the research side to understand the research, but also savvy enough on the political and reality, the reality of decision making in the policy world is absolutely central. So that when an issue is at the forefront, it's not a question of, can we do a research project that will take 4 years to answer that question? It's, what is the best information that's available, and how do I make that information easily accessible to the policymakers in a way that is useful for them and timely for them? And that is what I think the great advantage of having someone who is in that position is, because really this is an applied field. There's a lot of important basic research that's done related to health policy, but having it available to policymakers is really what it comes down to.
The Institute often works in a collaborative and multidisciplinary way, and I'm interested in sort of what kinds of collaborative experiences you personally had, and then your reflections more broadly in looking at the Institute about that, trying to both collaborate and then to do that across disciplines, what it brings to the work and the challenges that might be involved in that as well.
Well, one particular characteristic of the Institute when you and I were there was that we had no choice but to collaborate, because we were all cramped into very small and congested quarters. In fact, my first office was a converted bathroom, and I actually had a sink in my office.
I'm impressed.
Yes, it was a sink. There wasn't much room for anything else, but there was a sink in there. And what happened very quickly was that we realized that to do policy work requires different kinds of skills, but the skills have to be held by people who can work together. And we built some very strong working relationships that took advantage of different kinds of skills. We had economists come in, and a lot of economists like to do rather complicated esoteric research, but the economists that we had were people who understood policy problems and were interested in collaborating. And I can recall, for example, starting with Paul Newacek, who had a background in economics and who had absolutely no interest in working in child health. And Paul turned out to be a leader in child health research over the years. And a lot of that was because of the collaboration that went on. Working with Phil. Phil is the consummate collaborator. Phil is like a magnet with iron filings of collaborators, everywhere he looks. And so building those networks of collaboration proved to be extremely useful and important, both within the Institute and, of course, outside the Institute.
Talk a little bit about how your experience at the Institute influenced the way sort of your career has unfolded. You've mentioned some things about coming to Washington, but in other ways, it seems I can think of a number of ways in which, it's probably touched decisions that you've made along the way.
Well, I've had two major aspects of my career since I was actively engaged in pediatrics. I've had health policy work in university settings at the Institute and at 3 other universities since then, and I've had health policy work in government, both in the legislative branch and the executive branch. And the challenges in each area and the opportunities in each area are really ones that the kind of background that we were able to build at a place like the Institute for Health Policy Studies were very useful. For example, when I was asked to start a health policy research center at George Washington University and then to start an institute at Northwestern University, I had a lot of hands-on experience from my previous life, both at the Institute and then sequentially at each one. And that really built on itself. For example, one of the challenges that cuts across all university-based health policy centers is the tension between the fact that the universities are organized by discipline and the tenure structure is organized by discipline, but health policy and health policy centers are inherently interdisciplinary, cross-disciplinary, and if they're not, they really cannot get the job done because they need clinical input, they need economic input, they need experience in a variety of different kinds of health services research. But those might be housed in different departments where the reward structures and the kinds of journals that people publish in and the way that the people are looked to within their own departments might, in some areas, might lend itself to a fair degree to interdisciplinary work, but often does not. So that's one great challenge that I think cuts across all health policy centers. The other one is the fact that precisely, and this is related to the cross-disciplinary character of institutes and centers for health policy, is that they're largely dependent on soft money because university funding streams are departmentally organized as well. And so it's a constant challenge for people doing cross-disciplinary health policy work to support themselves. And if they have a support base in a department, they may or may not have enough money there or enough incentives there to really be able to do the kind of work that they need to do. And so it's an ongoing challenge for those people. And those characteristics on the university side really cut across all the places that I've been, including my time at the University of Oklahoma, where all of the people were on tenure tracks, but the structure for health policy research was there was no flexible structure at the time that I got there. On the government side, of course, that's where you have to actually make decisions. When I worked for the Congress, I was providing advice on what decisions should go along with various pieces of legislation that were being considered and major policy decisions that members of Congress had to make, and being in a position to assess what the best information was available at a given moment was extremely useful for me. And in my current job now with the Centers for Medicare and Medicaid Services, we make a lot of decisions that affect the direction of health policy every day. And so again, knowing what the literature shows, knowing what the research shows over a period of years, but combining that with what the practical realities are of decision making has, at least for me personally, been extremely useful.
Mm-hmm. What advice might you give to someone who's interested in working on health policy issues, working either in the university environment that you described or in the public sector?
Be as good as you can in a specific field and be flexible with your life. If somebody comes to me, and I've had a number of people over the years, as I'm sure you have as well, come to me. I
constantly send them to you.
All the time. If somebody is in medicine and wants to go into health policy, if they're in law and want to go into health policy, if they're in economics and want to go into health policy, I tell them, first of all, become a really good doctor and know what you're doing and have that as a base that you can operate from, or become a solid economist that you can live off your economics. But I say, but don't take that as discouragement, because it's really important to go into the policy world as well. Policy jobs tend to be few and far between, and sometimes they're fragile in terms of their funding source. And that's the flexible side of it. So be flexible, put yourself in a situation where you have more than one option, but don't be afraid to get deeply involved in the real world, because that's what it takes to do this. So I'm always encouraging to people to do this. I just want them to think through the fact that careers in health policy are extremely rewarding, but require sometimes a bit of dexterity in terms of keeping the money going.
Right, yeah, that's a good way of putting it. What do you think are some of the unique aspects of the Institute from the days when we were there that stand out and made it work and have the influence that it's had on so many people? Well,
the days that you and I were there were extremely exciting ones because it was a growth industry at that time. This was something new. It was the first health policy center that existed at a major academic medical center campus. It was something that was still imbued with major policy decisions that were going on at the time. It wasn't entirely clear what the structure of a place like that should be, what the right mix of talents should be, what the arrangements would be for funding. So there were a lot of lessons for all of us to learn. And we were thrown into that together, all of us, and I think that really created a spirit of friendship and collaboration that made the work and putting up with the vagaries and the difficulties of funding sometimes all the more enjoyable because we were able to work together. So that was a big strength. I think also the fact that, and I've discovered this with later work, the fact that we were associated with a major academic institution, one that had a brand name, if you will, and that brought a degree of credibility to the work. That's very important. I think that around the country there are a number of other places that demonstrate precisely that strength as well. I also think that we have to give a lot of credit to the leadership. Phil was and is, of course, a visionary who could see what a place like this could contribute on the national scene, and also had the persistence to bring it about. So I think leadership was very important in getting the place going. And Phil was an inspiration to many people, to us and to and to a number of folks since then to go into this field and to stick with it.
Right.
So those are the things that really jump off the page for me.
Talk a little bit about the Phil and Lou Butler combination also, since you worked closely
Right.
with Lou as well.
I worked closely with Phil, worked closely with Phil and with Lou both. Phil and Lou had the absolute brilliant sense that it would be a very strong aspect of the Institute to have someone who was an extremely well-known Democrat working with someone who was an extremely well-known Republican. Lou was a very solid Republican. He'd been involved in a Republican administration. Phil was well known as a Democrat, and he'd been involved in a Democratic administration. And the fact that the two of them, who had these different backgrounds and these different political alignments, could work together to build something, gave an air of credibility to the whole thing in a day before people could understand what an institute like that was all about. I think nowadays the fact that people have different political viewpoints may or may not be may or may not play the same role. But in those days, because this was a new adventure really within academic circles, it really played a very strong role. Also, the dialectic between Phil and Lou was I think, a great strength to us, because Phil is the consummately energetic, entrepreneurial type who has 1,000 things going, and the 1,001 is always around the corner. Whereas Lou was much more likely to have things in perspective and to put things, take time to work through things and think through things one by one, and to sort out what we were able to really take on and not take on. And so it was a terrific interaction between the two of them, and I think we benefited greatly from that interaction.
Right. And also, wouldn't you say they were both very unpretentious and accessible? So for young people
yes,
coming in.
Absolutely. As human beings, that was really what you just said. They were both. They are both. People who were, even though they were both prominent, famous even in their own rights, they were just down-to-earth human beings around, on a day-to-day basis, and that's clearly something that was of great importance to all of us.
Do you keep up connections with people from your days at the Institute?
I have kept up a lot of connections over the years, intermittently, but I have kept up. Well, I get in touch with you every few years, so it seems. Paul Newacek and I have stayed in touch. I've had some interaction over the years with John Shostak. And so there has been, and of course at almost any health policy meeting or assembly of any kind that I go to, it's Old Home Week for people from the Institute for Health Policy Studies as well. And there are people from the Institute days still in a number of positions that we bump into each other. So we have kept in touch. Maybe not as much as I might have liked, but sometimes we're a little too busy to do.
But don't you have the feeling also that with many of the people that you could pick up the phone today and call them,
any minute.
If you hadn't talked to them in years?
If I hadn't talked to somebody in 20 years, I could still call them, right. and we take each other's calls.
Yeah, there was something about that connection.
There is. It's very useful.
Anything else that you want to add to this, or something you wish I had asked you?
Let's see. No, not really. This is we've covered quite a bit. I think that we've captured what the spirit of the times was, and the role of places like the Institute. So I hope this is useful.
Great. Thank you, Peter.
Don't forget that.
Edit heavily.
Yeah. Right. Don't worry.